Of course, one of the questions that we talked about actually both through focus groups and through the survey was, what would the best, who would be the best suited to provide training for this group of providers? And the stakeholders had several thoughts on this. By and large, stakeholders really wanted many organizations to be able to provide training for peer providers. This makes sense as across the state there are several very, very good training programs for peer providers that already exist and have been doing this work for some time. And so counties have invested and organizations have invested a great deal of time and energy and effort into creating some very top-notch training programs. So the thought is that there would be many entities that would be training peer providers. And the other part of that is the group more often said that they would like a single certifying body. So you get your training from any number of organizations, but that training, that completion would have to be sent into the state, and they would be the ones to, or whichever certifying body it would be, they would be the ones to provide your actual certification. One of the issues around groups doing the training is looking at their capacity. You know, what capacity requirements would there have to be in place in order for an organization or a county to do a good job of training peer providers? So one of the issues is that the organization would be able to provide a variety of trainers that would reflect the unserved and underserved groups in our large state, and also that would adequately reflect the different perspectives, including transition-age youth and older adults. That the organization would have to be able to provide a variety of training modalities, and this would include things like online capacity and ways to reach people in more remote areas. That they would need to be able to provide educational supports to those people seeking certification. And that their core mission would be to develop core competencies within the peer providers that they train. Another issue would be that they would develop and provide courses for continuing ed. We're going to look at that a little bit later. There will be, in certification, a need to provide continuing education units. They were going to have to ensure the ongoing qualification of trainers and provide ongoing training for trainers. So it's not that somebody that's been doing it for 15 years just keeps doing it the way they did it the very first time. The idea is to continue to get your trainings updated and your trainers being really at the front edge of what's best practices and best ways of training. And within that they evaluate, monitor, and really ensure the quality of training. That a person coming to get peer certification training from the organization would be able to know that they're getting the same good quality this training as next training as any of the trainings that might go on. A second issue that was addressed by the stakeholders was the issue of the need for the organization to have cultural awareness and responsiveness capability. In addition, there was the issue of having specific skills and knowledge. That training peer providers requires that you really know and understand these values that we keep talking about and the particular role. And finally, that it's a more process-oriented training. So this is different than a standard didactic kind of training. It involves much more collaboration and learning and community learning as a model for how it's done. Overwhelmingly, 97% said that training peer providers should be done by people with lived experience. And lived experience would be the key element in doing this well. There was a few people who thought that any peer could train to another peer of any different type, but the majority actually thought that family partners should train family partners, parent partners should train parent partners, people with lived experience to lived experience, that made the most sense, and that was the idea, that was the most prevalent idea that the stakeholders had. Another key issue around training is how to maintain peerness. So in that, you see that the ideas the stakeholders had on that was that peer support specialists had an opportunity to network and support each other. This was by far the largest recommendation. Without that, the role drift and lack of clarity about what the unique services are that peers provide was a real problem. They also thought it should be included in training curriculum, and that there should be a definition of peerness that everybody gets to know and understand, helping both colleagues as well as the peers themselves. The recommendations the stakeholders came to in this area were to develop standards and oversight of training providers, and that the trainers must be individuals with lived experience or consist of a team of persons that includes somebody with lived experience. Ensure that a number of training organizations would be eligible to provide these trainings, and ensure that these organizations have the infrastructure needed, which we just went over. And another recommendation is that a policy is developed that supports the importance of maintaining the peer role, and that wherever this is happening, people create networking opportunities, formal and informal, to allow the profession to grow and allow peer support specialists to hone their skills and their values and principles in action. So the issue of who will actually provide the certification was another question asked of the stakeholders. Across the country, we know that it's primarily done by Department of Mental Health in each of the states we looked at, although sometimes it is done in combination with a peer provider organization. And also sometimes it's done by universities. So those are the three most common entities that provide the actual certification. And here you have a listing of the states that we looked at and who is doing the actual certifying. You see that there's some variation, but it's primarily the three kinds of entities that we just went over. When asked as a group who they thought our certifying body should be, you can see that it's fairly evenly distributed. So the thinking is not clearly one way or another. It's quite evenly divided between a CBO, which is a community-based organization, Consumer Youth Family Parent Provider Organization. Then we have the state of California at 23%, community colleges, and then universities. So you can see there's not, it's not swinging one way or another and in big numbers, and that the stakeholders at the summit will really need to wrestle with this. Most folks did think that there should be a single certifying body. So 51% did think that it should be one group that does the certification. Although you see, again, a fair number of people were thinking two certifying bodies would be a good idea. When it came down to it, the recommendation from the group was to select a single certifying body to implement and manage the certification of peer support specialists. And the suggestion was that this would preferably be an existing state body or a statewide agency that represents peer support specialists. Another critical issue for the focus group and survey information from stakeholders was about who should supervise peer support staff. And this was a question that came up earlier in our questions for this webinar today. So it's a very important issue. So stakeholders, by and large, said that they would actually, in conversation, that they would really like to require lived experience for supervisors, but that was more of a capacity issue. Not sure that there were enough peers that have currently been hired that could move into supervision positions across the state. So what the compromise was that supervisors who were not someone with lived experience needed specific training. And the specific training we'll go through in a minute to say what they thought that the training ought to consist of for people who are not people with lived experience themselves. So interestingly enough, the training for supervisors focused on the management style of supervisors, and that the management style be reflective of peer support values. And these are values of collaboration, of mutuality. It's a flattened hierarchy, much more circular feedback and evaluation processes. And, you know, if any of you have been supervised lately by anyone, that's not exactly how it's done often, is this sense of we're all in this together. So peers have a value around this that's both very interesting and would probably provide a fair amount of challenge for the individuals to enact in practice. And secondly, I want to point out that the supervisor needs to have the ability to create a wellness, recovery, resiliency environment for both clients and staff. And again, in our work across the state, we found this to be absolutely key, that peer support, peer providers coming into a system that doesn't really do wellness, recovery, resiliency creates a lot of barriers and a lot of unnecessary problems. And here we have the personal characteristics that were identified by stakeholders that they would like to make sure that these supervisors have. And as you can see, I don't think anybody would argue with these characteristics. I think we would all really appreciate. And I have had supervisors that in my life that have been this wonderful and would hope that for everyone to have that same experience. Recommendations in this area were to develop a policy that establishes actual qualifications for who may supervise peer support specialists. And when the person is not a person with lived experience, identify the specific training that they would need and really look for the personal characteristics that match these values. The last question of the focus group was, do you have any additional comments or suggestions? And this was great because it allowed for very broad, open-ended responses and gave us information we would not have gotten without this open-ended kind of question. So the three issues that had the most responses across the state were concern about integration. So 52% of responses that we got talked about peer providers not really being part of the team, not really being included in staff meetings and other activities, a sense of being marginalized and isolated and somewhat misunderstood. These are all integration issues. And so there's concern that there's some larger employment issues needing to be addressed. The second one was career ladder and workforce issues, including the fact that there's simply not enough jobs, and then when you have jobs, there's not enough mobility, advancement opportunities, and also a concern about the curriculum. There was a lot of discussion of needing to have a lot of input into what curriculum standards are established. And the recommendation in this area was to create welcoming environments that embrace the use of multidisciplinary teams that can incorporate peer support specialists onto the team, and to provide very extensive and expansive training on the values, philosophy, and efficacy of peer support to mental health administration and clinical staff. And one of the things in our last webinar, we provided a whole list of research citations on the efficacy of peer support. And so I think this is important information to get out. We also got the recommendation from stakeholders to develop a statewide definition and code of ethics and develop career ladders that begin actually with non-certified positions. So some of your other questions that came in were about, maybe people don't want to be certified. There was a sense of inclusiveness around that. Yes, there might be people that come into our system without certification, and that's fine, but that there would be this career ladder opportunity, certification, and then movement to other kinds of positions. Also to develop statewide models that can inform county leadership on these things. So we are opening up for our second question period, and would like you to, again, raise your hand or type your question into the box.
And was this specifically questions about training, about the recommendations that we just talked about?
Yes, this would, we're stopping along the way to really have your input on the information from the last question period to now. So we have a question, how would those already certified keep up with more training if they're not working as a peer specialist at this time? And wondering if the plan would backfire on those that aren't working as peer specialists now if they need more current training or continuing education. Well, that's a very good question, and I think one of the things, Lucinda and I have a certification as a CPRP, Certified Psychosocial Rehab Specialist, and what we have to do is continue to maintain that certification even if we weren't currently working in the field. So if we thought we might come back at some point. So I think that would be the model that we would consider for this certification as well, that it would last a period of time, and then during that period of time you would be required to get some hours to continue your certification. So it is something that each individual has to keep up with and has the opportunity to get the trainings required, hopefully through their county or through the state. And the question is, are you personally peer supporters or advocates of peer support? I don't think we would, we're not in positions that are peer support positions right now. Both of us are doing primarily training. Myself, I identify as a family member. Lucinda identifies as a person with lived experience as well as a family member. So if that was what you were asking about, I hope that answers your question.
Yeah. We're going to get to grandfathering in, Jennifer, very shortly. And does the recertification include refresher courses in the community?
Well, those are some of the details that will have to be worked out, but I would imagine, yes, that we would want to provide those kind of opportunities. Another question, how are we addressing the issue of validating peer providers having lived experience in some areas? And that people are employed with that title who have no experience with behavioral health issues themselves. This is a very important question around what does it mean, what do you find, how do you know someone has lived experience, and what lived experience are you looking for? There are various ways to address this issue. I know that in San Mateo County, one way that it was addressed was that in the hiring process, people were asked to do an essay question that explained their lived experience, and based on their answers to that question, the people hiring were able to determine what kind of lived experience the individual had. A very good question, and there are probably many more ways to address that.
And Darcy's asking about, or making a statement that wages and compensation will need to reflect the cost of maintaining certification.
I absolutely agree, Darcy, that wages should be considered when requiring things like certification and CEUs and other qualifications. Absolutely. Okay, thank you very much for your questions on that section. Let's move on. We've got a lot more to cover that we want to get to before we have our final question and answer period.
Okay, so we're looking at curriculum and what folks at the stakeholder groups said about that. And this is a really important area to be really clear about, because it's unfortunately in the report it didn't make it real clear, and that was so we're going around now trying to be clear about this. Basically, what the stakeholders said is that they wanted to develop a core curriculum that all peer support specialists would get. And then beyond that, there would be curriculum specific to people with lived experience of a mental health issue, people who are parents of children, and people who are family members or parents of adult children. So that the type of curriculum would basically have a basic core curriculum, and then the curriculum to actually certify as a particular type of peer specialist would also be included. So we're not, the stakeholders did not say that they want one curriculum that every type of peer support specialist would follow, but that they wanted a core. And at that core, what you see on your screen now is a list of what they thought was important for the core curriculum. And interestingly, the number one response was culture, that they want people to be able to be culturally responsive and culturally appropriate. That includes peer culture as well as family and parent culture. The next one was actually role, and how, what is the role of the peer provider, and how do you stay within your role in your workplace. So as you can see, there's a whole list of core curriculum topic areas, and then again on top of that would be the specific areas of focus for the specific kind of peer support specialist. Moving on to the qualifications for certification, people most often said that the qualifications for certification would be, and we seem to be missing a slide.
We're actually going to polling question now, I guess. Sorry, we're looking at our slides and wondering what our
okay, what I see.
We might have a little different.
We have a little issue here. You know what we're going to do is we're going to go and so instead of moving into training, we're going to talk about the training programs that you already have existing. So if you could respond to the polling question, which is Deb's going to read the polling question for us. Do you currently have a training program designed for peer support providers? And the answer is yes or no. And there's a follow-up question to this as well. We have about 50% responding, and the majority so far are saying that yes, they do have a curriculum. And while we're waiting for the poll to close, one of the questions is, what's the purpose of separating family members from peer support specialists? And the stakeholders' feeling about this was that there are specific issues and training that people who are working with parents and or family members need to have, as well as people with directly lived experience need to have a specific training and knowledge base for working with consumers or people receiving services themselves. So it's not that we're separating them, it's that it's acknowledging that there are different roles and that they have certain skill sets that they need particular training in. Jennifer is asking about how do you ensure that your peer support employees actually have peer support experience? And one way you do this is that if the qualifications include a particular kind of life experience, which is actually legal, you can then carefully ask interview questions about that. So there are perfectly legal human resource ways to go about finding out if the individual you're trying to hire actually has experience in that area. So we're going to go ahead and close this particular polling question because we have the next one coming up. So with 75% voting, 61% of you said that yes, you do have a training curriculum. And then the next poll question asks you, which should be coming up on your screen shortly. If you have a training program, does that training program, is it designed to train people with lived experience to work in the mental health system doing a variety of jobs? Or is it specific to training people with lived experience to provide evidence-based peer support? And the third option is both A and B. And Jennifer is, while we're voting, Jennifer is also mentioning that there was no mention of self-disclosure and appropriateness in the curriculum. And actually, I think their self-disclosure in particular may not have been the wording they used. I think the wording might have been self-awareness. And then that goes along with then how do you disclose and what do you disclose and when. But that definitely is part of the core curriculum. About 53% of you have voted. We could get the rest of you to vote in. So Raven is saying that NAMI's peer training requires its trainers to then train others as a requirement if the state paid for their training. Oh, would this be an option? That's an interesting question. I'm not sure. That's certainly something we could look at, but I don't know the answer to that question. And Juno is asking about how can we best address concerns about peer values getting lost as we get included in the mental health system? How can we influence the existing system to include peer values and strength-based mental health care as opposed to pathology? And actually this is at the summit, what you will get is the recommended values and ethics and the recommended definitions. And those are very, very clearly specified. And they're done so as a way to avoid that drift and a way to include those values into the system. And so those are some of the things that are going to be presented at the summit that stakeholders will be looking at. And one of the things they'll be looking at is, are they strong enough to maintain the role of peer values in the system? And we're hoping that they will be. Sal is asking about what type of lived experience criteria will be considered for purpose of the certification, and that's a very good question. That has not been determined, and that will be a summit question as well. Some states define it as being 1 year in quotes unquote, being 1 year in recovery, meaning that for some people that means having utilized a RAP for a year. Some people self-identify as being in recovery from psychiatric challenges. But it's a question that's going to have to be more fully developed and answered. Okay, so with that, we're going to close the polling with 59% of you voting, and 54% of the 59 who voted said that you have both types of curricula, so that's really good to know. Okay, so now we're going to move on to what the survey responses were in relationship to training for peer certification. What the survey results showed from the stakeholder meetings was that most people thought it should be between 55 to 100 hours, although a significant amount of people thought it should be more than 100. And we even had some people, more than 100, which is the highest I think that we've seen across the state is at 100. Next one was how much work or volunteer experience should you have to be eligible for certification? And the majority of people thought that 3 to 6 months of full-time equivalent experience would be appropriate. But again, another sizable group thought 6 to 1 year. Then the question of whether there should be an exam required was looked at, and the vast majority of people thought that an exam should be required. However, the caveat to that is that there should be educational supports for an exam. For example, the exam may be done orally versus written. There might be different ways to evaluate performance beyond a typically structured exam. So that was very important to stakeholders as well. Stakeholders also thought that people should, in order to maintain their certification, should have CEUs. Most people thought between 10 to 15 hours of CEUs. Moving to other, how often people should be recertified, the majority of people thought that every 2 years was an acceptable amount of time for recertification, although a sizable group thought every 3 years would be appropriate. Here we are at grandfathering in, and I know there are 600 people in Riverside wondering about this. And the stakeholders did agree that there should be a grandfathering in component, and that perhaps that would include a minimum year of experience, or another group of people thought that a set number of years of experience plus 3 recommendations would be a good qualification for grandfathering in. So based upon all the information that was gathered through the stakeholder meetings as well as through the survey at the stakeholder meetings, the following recommendations were presented. That training should consist of a minimum of 55 hours. That, again, that a core content be developed, but that there would be specialty modules for each type of peer provider. That an exam should be required, but again, with adequate educational supports. That we establish a volunteer or work experience requirement of 3 months to 1 year. And that 10 to 15 hours of CEUs be required per year. And that recertification occur every 2 years. And that we allow for a grandfathering in process to include at least 1 year of full-time work or full-time equivalent, and 3 letters of recommendation. We then moved on to a discussion of what the stakeholders viewed as barriers and concerns. And this then did elicit a number of other recommendations, or several other recommendations. So what people felt was that the current practices in hiring peers were the most common barrier to real employment as peer support specialists. And that was by far the largest percentage of concerns that people had. And then when we looked at that, we broke that down into what were the practices that people were concerned about. And the number one response is that there was a lack of availability of jobs. Now, this is not true in all counties, but it is certainly true in most counties, that there just are not enough jobs to meet the demand. And then again, the number, a very high percentage of people recognize that civil service barriers really did create a barrier to employment, as well as a barrier to maintaining your peer role. So if, for example, you couldn't include newly coded positions into your civil service jobs, people would be hired into generalist positions, and it would be much easier to have role drift or job drift within that, and that was a big concern. And then again, the acceptance by traditional mental health staff is also a very huge concern, and that goes to the issue of welcoming environments and integration of people with lived experience and family members and parents into jobs in the existing mental health service, or in the existing mental health system. And so we have 3 recommendations related to these issues. The first one is that we need to address the problem of lack of employment opportunities by establishing a statewide minimum so that each county would be required to hire a minimum number of peer support specialists within each category. This is a way of helping counties to comply with the intention of the Mental Health Services Act. The second recommendation was to develop a statewide solution to deal with the civil service barriers to employment so that peer support specialists could be coded, or could be employed into actually coded positions. This obviously is a very large issue, and we're not even sure there is a statewide solution to it, but definitely stakeholders were interested in evaluating that. And the final recommendation was to develop a plan for funding certification process through using some of the workforce education and training monies from the Mental Health Services Act. These monies are now currently, the statewide monies are now currently under the auspices of OSHPD, and most of you probably know that OSHPD is conducting stakeholder meetings across the state, and this is one of the things that Working Well Together has written talking points about, and asking peers, providers to go to those meetings to support the use of some of those WET monies for establishing a certification structure. We are now at our last question and answer period and our last slide, so we have about 8 minutes to go ahead and answer any other questions. And we're going to first go ahead and open Boanna's mic so that she can go ahead and ask her question. You're unmuted, Boanna. Okay, she may not be able to speak even though she's unmuted. So if you'd like to type your question in, that would be great. Any other hands? Sandra, we'll go ahead and unmute you. Sandra, are you there? Sandra?
Yeah, I'm here.
Hi, did you have a question?
Well, I typed it in.
Oh, okay. Then we'll
I'm looking for it. I don't know where it's at. I was wondering what this 1-year minimum of experience meant.
So the recommendation was that to be certified that you have 1 year of work experience or volunteer experience as a peer support specialist to be eligible for certification. So we'll go ahead and go to the written questions. One of the questions is about, will people have the opportunity to attend the webinar? And one of the things that we have, attend the summit following the webinars. We have extended the amount of people who can go by 50 people. So if you are on the wait list or you're not on the wait list and you want to, go ahead and get on the wait list, and we will be opening up those slots as they are available. OSHPED, sorry, using acronyms, that it's the Office of State Health, Education, and Development. And it's the Office of State Health, Education, and Development. So that is the organization that now has the WET monies, the statewide WET monies anyway, and they will be making a plan about how they want those workforce education and training dollars spent. When is it expected deadline to implement a statewide certification? There really isn't a deadline to implement the certification. What we would need to do if we want to get into this round of the state plan is recommendations from the summit would need to be transmitted to the Mental Health Directors Association and then to the Department of Healthcare Services for consideration in the state plan amendment. Once that happens, then the whole process of developing a certification process would have to occur, and that would include access to funds to do that. So it's going to be a process that will take a year or two. And Ellen, you've raised your hand, and we're going to try to unmute you and see if you can go ahead and ask your question. Ellen? Okay, Ellen may not be able to speak even though she's unmuted. I don't know if she's typed her question in or not. Okay. If there are any other questions or comments, yeah, Carol has a comment about peer support specialists and job titles, and she's found that there are over 100 job titles that she's found which are used for peer support specialists. Right, and that we're not sure what you're asking, Carol. I don't know. Can Carol be unmuted? Carol, are you able?
I'm not sure if you can hear me.
Yes, we can.
I'm working. Yeah, I'm a community health worker, having done the community health worker certificate training at a junior college. But I'm also a person with lived experience in working with Sonoma County, and we hope to do a peer home visiting program. And I have been involved with the American Public Health Association Policy Division, and they are looking at the definition of a community health worker, and that's why we started collecting the job titles, and one of which included the peer support specialist. And it was really, really hoping that that we can kind of join forces in that the values and the kind of lived experience component is so essential for the work that we do to have meaning and to maintain trust. So I guess it's really hoping that we can collaborate at some point, because it seems like the discussion that you're having in the mental health field is really applicable to many areas of peer support specialists, whether it's for youth or post-prison health workers, or homelessness, or drug and alcohol. If people have had that lived experience, they really are peer support specialists. Yeah.
Excellent. Thank you so much, Carol. And I'm sure Karin is going to jump at the opportunity to work with you and collaborate. So we have your information, and Karin, I know, will be wanting to get back to you. So yes, any collaboration is always a good thing if it, you know, furthers definitely furthers the peer specialist cause. I did want to mention that if you are already registered for the summit, you do not need to re-register. If you are not registered, you may register, but it doesn't guarantee a space. So we are releasing entrance into the summit based upon availability. So if you're already registered, you're on the list. If you're not registered, you can go ahead and register, but it's just not a guarantee at this point, because we have more people registered than I think we have more interest than we have spots. So we're having to make a wait list and then release the wait list as we can. So I hope that answered your question about the wait list, that as we're able, we are releasing we're taking people off the wait list and putting them onto the registered list as we're able to. So if you're not already registered, go ahead and register. If you're already registered, you don't need to do it again. Terribly sorry. I'm answering that because people are still asking about that question. So the summit will not result in any certification. The summit on the 17th will merely result in recommendations that we will be making to the state. And that will be to the Mental Health Directors Association, to DHCS, and to OSHPD, would be my assumption. We want to thank everybody for joining us today. We're hoping that people got a lot of information. And Karin, did you want to say a final few words?
Yes, I want to let everybody know that I will send out the link to register for the May 17th May 17th summit. You have to go on the wait list, so because it'll say it's full, so you have to go on the wait list and then email me what county you're from and what affiliation, because we want to ensure that counties that are not yet represented can be represented, and that stakeholders that are not yet represented can be represented. So, so please, you know, I'll send out the link, and everybody can go on to the wait list and then email me.
Excellent. Thank you so much, everybody.
And one more thing, and that is after you finish the webinar, there will be an evaluation that we ask you. It's like 11 questions or something, a multiple choice. If you could please answer, if you could please do the evaluation, it's really important to us. So we're going to give it to you at the end of this webinar, and you'll automatically get it. And then also we'll send it out, I think they send it out like a day later. So please just do it once, of course, but please do it. Thank you so much, everybody, for your participation. And have a great day. This will conclude the webinar.
Thanks, Karin.